informative, educational, objective, inclusive, comprehensive. This is Progress Report. Updates and conversations from the Government Information Service.
Good day and welcome to another episode of Progress Report. My name is Ivan Connor and this is my lovely co-host Gleneva Hodge, and we have with us in studio today the Honorable Premier of Anguilla, Minister of Finance, Minister of Health, and so much more. We're going to get into so much more because there's so much more. The Honorable Dr. Ellis Lorenzo Webster. Pleasure to have you here, sir.
Thank you, Ivan. Thank you, Gleneva. It's a pleasure to be here.
This has been a long time coming again.
Long time coming. So I think you know what we're going to do.
Yeah.
The longer that the premiere takes to come, the longer the episode.
Okay.
So right off the bat, I am telling you we are going to be doing a 2-part episode. We're going to break this up into chunks. We're going to start with health.
Yeah, we should.
I think because I'm really, really excited about some stuff that I've seen out there. So we're going to start with health, and then in the next hour, then we're going to do finance.
Yeah.
Remember,
finance kind of
I turned a year older since the last time we met, so be easy on me, you know?
And we do have to touch that as well. There's so much happening.
So much happening.
And you didn't even mention economic development, which is under his purview.
Good. So maybe we do a little finance in each episode. So we do health and finance, and then finance and economic development in the next one.
I agree, because you can't touch health with the major announcement in health and not speak to finance.
So finance is going to run throughout
the episodes.
Both episodes, but we're going to split health and then economic development on the other side.
Okay, so we've established that. We're free to dive in now.
We're free to...
Wait, before we get to the hard questions, Premier, is there anything you want to say to the listening audience before we deep dive into this amazing news coming out of health?
Definitely. I mean, you want me to talk about the thing coming, or just
he wants to get there just like us.
Let's do a recap.
I just want to say thanks for allowing me to be here, and I want to thank the people of Anguilla, and in the diaspora for being there, supportive, and basically helping us along the way.
Excellent. Where do you want to go?
A quick recap of the first quarter as we look at health.
Yes, what has happened in the first 3 months of the year thus far?
Oh, certainly. One of our focus was to bring health on stream. The first 2 years was basically stabilize the country economically, socially, and now we can deal with health. We would like to deal with that from day one, but, when we came in, the economics of the country, the finances of the country were deficient. So, true.
You remember that from the first episode?
Yes, a couple hours cash.
We set our reserves for a couple hours. We were supposed to have 25% of our recurrent expenditure in reserves, which is usually 3 months. We only had a few hours.
Yeah, we had a few hours.
But here we are, and so we can tackle health now.
Okay.
So we decided that we got assistance from the Richard Schultz Family Foundation to get an MRI scanner.
Yes.
That is on island. In fact, the MRI technologist is here that can run the scans. The trainers came back to make sure that he is up to speed, and we're just about ready to go with that. So that is a great, addition to our diagnostic capability. We'll be able to do MRI scans now of the brain specifically, but other areas of the body, soft tissue, that we're not able to do before, where patients had to be sent out. And I certainly think this will help with taking care of our people.
If we can put a pause right here, we're gonna be doing a lot of pauses because I must go back to something that you said. I don't remember if it was a press conference. I was at the dedication of the MRI machine, but you spoke about early detection with this technology as opposed to later down the road you could identify possible strokes and all the other things coming on,
yes,
so to speak.
And certainly I said, and I think it was at the dedication
Yes.
of the machine, Dr. Ward had and the director of medical services had stated what the difference between MRI, CT scans, X-rays, and things like that. And one thing that MRI can do, it can detect smaller lesions, say brain tumors, aneurysms, small strokes. Before you would have to wait until the symptoms were there, florid symptoms, weakness, severe headaches, vision changes. Before you would know that somebody had an impending stroke.
Yeah.
Whereas now with the MRI, somebody presents with, say, dizziness, headache. You get an MRI scan to show you if you have ischemic changes, then with decreased blood supply to certain areas, and that may be small, and you can treat that with anticoagulants or like aspirin or something to thin the blood so that you don't then progress into a stroke. And so the early detection then also allows you, if it is a brain tumor, that you can get it treated, whether it's stereotactic radiation, where you can just basically zap it, or you can do surgery and you're moving a smaller portion of normal tissue to remove the tumor. So these are aspects. Also, the thing about MRI is, say somebody has cancer and they have metastasis, it's spread. MRI tends to pick it up much easier than a CT scan or other modality.
And saying all of this again is why I can't downplay it, because I know like many people been waiting for this.
Yes.
And to hear that the technician is trained now and they should be coming on stream with all the other news that we have already happening this week, that is excellent. I can see our people really benefiting, and even those that come in, because if we're going to talk the MRI machine, we can't not talk the dialysis unit, which is right there as well.
That is
And
correct.
I understood from Mr. Archer, for Archer Romney and Beck, that they were just waiting on a panel that was ordered 6 months ago to finish up the electricity work, and it hasn't come. They're still shipping backlogs and those type of things globally. But when I walked in there, I think there are 8 spaces now for dialysis. We had 2.
Yes.
And people used to have to wait in the schedule because they're not just Anguillians. People used to come from St. Martin, Nevis, and other places for dialysis.
Exactly.
Now we have this state-of-the-art facility. We have 8 spaces for the dialysis machines. So it's not that we were trying to tell people go ahead and still reach to the point where you need dialysis. Don't get us wrong with that. But we are able to better care for our people now.
And we have to forward project,
Of course.
I mean, you find that with the increase in non-communicable chronic diseases leading to kidney failure from, say, diabetes, cardiac disease, high blood pressure. And so we find that we need that. And, we certainly want to do the prevention first, the education, the community health, so that we can get there before you need to get there. And we are working on that.
Yes.
That is also coming.
Yes.
But we have the dialysis.
It sounds like there's something
unit.
in the pipeline that I'm going to be digging and asking about.
So we got the MRI scanner, so we'll be able to do better diagnostics now. It adds to what we're capable of getting done. And we now also have coming on stream, as we've been pushing it from even before the election, to get a policy in place to do free health care for those persons who are 70 years and older, belongers of Anguilla. It's took a while coming because one of the things we were told when our first executive council meeting was you can't have unfunded policies. And we brought this to executive council way back in 2020, and it was pushed back because it said you can't fund it.
Yes.
But now we showed, did the actuarial study. It shows how much it will cost. We found the money. We put it in the budget, and we're ready to go.
Sorry, Lady. You go ahead.
I don't even want you to go there because you know we're going to go there. We are. But I want to actually take a moment to, because this episode will air after the launch of this program, and I think that's important for persons to understand that we sometimes have to pre-record our sessions, and so by the time the listening and viewing public hears and sees this, persons will have already begun signing up for this program.
Yes.
And Ivan can tell you, I for one am very, very excited about this. I mean, I have 2 grandmothers who are over the age of 70. I have been hearing since the beginning of the year, since it was passed in the budget, every time someone goes to buy medication for my grandmother, I have been hearing, but I thought it coming. Where is it?
Yes.
And so I know when Ivan kind of whispered in my ear last week about it, I was able to go and say, it's coming. And I can tell you, I heard, yes. Because she listens to this show religiously, and my aunt, and she said to me, I went to the pharmacy this week, and I was told that no, it's not. She said because every time she goes to the pharmacy, she asks, "Is it free?" and so no. So by the time she's hearing this, you will have announced, you will have had your entire launch. So we can go ahead and speak about some of those things. What does that look like? And I know Ivan wants me to plug this. We are here. It is now a funded policy. It is funded how? Is this external funding? Are we receiving funding out of the UK?
No.
How are we funding this?
This is funded by the taxpayers of Anguilla who are paying into the consolidated fund. And isn't that good to be able to say that?
It's
I mean, just think about it. 1967, there was a revolution fought so that Anguillians can have some independence, some self-autonomy. And to be able to say that this is funded by the government of Anguilla rather than saying this is funded by the UK government and the generous taxpayers of the United Kingdom, which is something that we've been saying since 2017. We've been saying that over and over. And we thank the UK government, and we thank the governor for advocating on our behalf, and the ministers for the overseas territories, and the generous taxpayers of the UK, because they funded the dialysis unit, and so we thank for that. The isolation unit, which we're working on, refurbishing the psychiatric unit, because mental health is very important. But government of Anguilla is funding the budget to get a psychiatrist resident in Anguilla. That's what we're working on. Funding a second general surgeon, funded by the government of Anguilla. And now, well, just to say that we have this. I am very excited.
You cannot contain your excitement. I love it.
This is something that we said we wanted to do. I spent some time in the United States. I know that's news to people, because they think I just sprouted up from somewhere because I'm not Anguillian enough. But anyway,
jokes.
The reason for this, though, I just want to say the reason why I think this is important is that I feel that the persons who are 70 years and older were the ones who fought the revolution in 1967. Because we are now 56 years past that date. So there would have been, my math is not that good, but there would have been, 14 plus at that time. And they're the ones who made it happen.
And has carried the country throughout. I mean, in all honesty, this truly is growing sustainably together. I'm not going to get away from what GST means. It means growing sustainably together, and this is it. Because guess what? Somebody told me, like, when we put out the notice about the launch, there was like, this impacts our many hotel workers that left without a pension. That have health concerns that's still around. Like, this is something for them. So when you talk about the fact, when you hear persons complaining, there's no pension for the hotel workers, but there are ways and means to provide assistance. And this is one of them. This is
That's
excellent because it covers everything except private physicians.
And private pharmacies.
And private
but
pharmacies.
everything in the public system. The hospitalizations, medical, surgical, in the hospital, in the clinics, the 3 clinics
Yes.
that we have.
Dental.
The pharmacy, so anything in the public system that's now health authority
Yes.
that in the next few months will be, Ministry of Health, Department of Health. That's
smiling
another
again.
thing coming. Any of that will be covered for those who are now, belongers of Anguilla who are now 70 years and older.
Yes.
And as you get from 69 to 70, they'll come on stream.
stream.
And certainly I think it's important. I mean, we started with the vouchers, it was $500 twice for those 70 years and older. And people ask me, why 70? And I said, why that was because in 67, those who are now 70 would have been 14 plus. And I think that they're the ones who fought the revolution. And I think that they need to be, to benefit
Yes.
from what they've done for us to put us on this path to progress.
Yes.
We couldn't be here without our forebears who fought on our behalf.
Not at all.
And that type of self-esteem which they imparted to us,
Yes.
that sense of autonomy, independence, which has helped us to get where we are.
Yes.
Because we couldn't get here if we didn't have that spirit
That is
of
a
the
fact.
people of the revolution.
That is
and
a
then
fact.
so I think they need to benefit, and this is a way to do it, to get them on that sustainable path, because they're not working now.
Right.
And as we know, the older you get, the sicker you can become.
Yes.
And it's really hard when, somebody meets me and say, my parent or grandparent was in the hospital and they got a bill for $20,000 or even more.
Yeah.
And they're asking me if there's somewhere that we can help. Now, I can say now, you go to social development, and social development will do a means test. They'll see if you have land, if you have a bank account, if your children can help you. I don't think that that's fair. I don't
Right.
think it's right.
Right.
And so with this policy that we now can fund,
Yes.
which starts soon, I don't know if you're going to, give
Me
that information.
first.
Oh, so you let the cat out
I
of
let
the
it
bag.
go
So I can,
because the cat will be left on the bag either way.
It's gonna be out there before this year. So yes.
so I can say it this.
Yes.
That now any person who's 70 years and older who's an Anguillian belonger goes to the hospital. We don't want them to have to go to the hospital. We want them to be healthy. But certainly if somebody goes now, they know, their family know that they're not going to get a bill of such magnitude that they can't afford.
Right.
That will go to the Ministry of Health to be paid from the coffers of the government of Anguilla.
Premier, that is lovely.
It is. And I want to stick a pin I'm going to take from Ivan. And just for some clarity, because I've seen some of the literature, I've seen some of the information. Just so that persons are aware, they're not going to just show up at the hospital. Persons are required to register
Yes.
Correct.
beforehand.
Yes.
And registration
Began yesterday.
right. So registration began yesterday and coverage begins on
May 1st.
May
1st.
1st.
Yeah.
That's correct.
Right.
And then just to go back a little bit, because you spoke about those family members, and this is the impact that I'm most excited about. You spoke about those family members that have to pay those bills,
Yes.
because it's not the elderly that's paying those bills.
Well, they're not working, so they can't
Exactly,
pay.
and most of them left work without a pension
That's right.
and the like.
Yes.
And the family members that have had to pay those bills, been paying those bills for a while, there's a number of family members who are supporting through purchasing the medication for their loved
Certainly,
ones,
certainly.
who's paying the bill, who's paying the electricity bill, who's doing everything else. And I said a few shows back, money saved is money earned. When you don't have to spend $1,400 and grandma medication for the month,
Right.
and the doctor visit, that's $1,400 in your pocket that can go towards something else.
Definitely.
I can tell you. I mean, just in speaking to persons and since the release came out that you're going to be having this launch, someone said to me, "I am so grateful because now I don't have to go and sell the piece of land to be able to afford my mother's health care."
Wow.
because that is the reality that a number of people face.
Yes.
But
When-
the other, just
Yep,
the other thing that, and you just touched, I was told by persons, that they would forego food so that they could get their medications, or vice versa, because they had to make that choice.
Wow.
And I don't think that that's a choice that anybody should have to make. That these days.
Yeah.
I agree.
Yeah.
For me, it's the true measure of a nation and the empathy and how strong a nation is how it takes care of its children, its elderly, and its most vulnerable.
Right.
And they
And
say
this-
we don't have a vision, but that's the APM vision right there, right?
Yes, you read it. You read it recently. You read it recently.
Oh,
huh?
Sorry, no politics, no politics.
No, but I did not even hear that. But that
Yes.
is the reality. It's how do
Yes.
you take care of those who are most vulnerable
Yeah.
That's
within
right.
within your
correct.
society.
That is correct.
Go ahead. I'm going to say something after you say what you
So
say.
it's almost tying in, and you spoke about the house, and
Uh-huh.
again, a lot of this is just from we did that walk through, and we're gonna stick with health for a bit, but I
Yeah.
just wanted to tie it in, and I know that there was additional funds asked for the completion of the
ALHCS.
ALHCS site. And so again, it speaks to, and Ivan preaches this, and I laugh when you first brought it out, growing sustainably together. But it again just ties in where we're taking care of our children.
Yes.
Yes.
We're taking care of our elderly.
Yes.
We're taking care of our most vulnerable, and included in the most vulnerable is persons with mental health. And so
Yes.
hearing the premier speak about
Residents.
being able to have a resident psychiatrist,
Yes.
that is the first step in us being able to take care of our mental health as a nation
Correct.
as well.
I mean, and just that you're saying this, like, have we ever had a resident psychiatrist?
No, we have never had a resident psychiatrist in Anguilla. We've had psychiatrists. One used to come from Antigua to Anguilla once a month and see the patients that had, mental issues. And with COVID, we've now been dealing with one
Right.
in the BVI,
Right.
but it doesn't come to Anguilla.
It's
But,
virtual.
but you got to have somebody here to. It's that facing somebody
Right.
that you can explain and that psychiatrists can understand
Yes.
culturally,
Yes.
and from what you say, the history that you give of why the
Yes.
situation exists. The other thing that we're looking into is remote counseling, and so PAHO is now working with me, looking at how we can work through a platform that exists where persons who have concerns, they can call or get online with a counselor who's not in Anguilla, a psychologist,
Okay.
and they can get help that way. Because we want to make sure that there's many avenues as possible
Right.
to get people back to full health. And mental health is a disease. It's not
Yes.
something that a person is crazy.
Right.
It's a disease process that needs to be treated just like if somebody is doing surgery or they're treating with medication for a health problem like
Right.
diabetes, high blood pressure, or something else.
And just like with diseases, it also there's a component of mental health that is also preventative care.
That is correct.
And
That is
so,
correct.
for me, I'm a huge advocate for therapy and counseling. And just to put the plug, we know that we have SAFE,
That's right.
the free psychosocial and domestic violence hotline that persons can always call into
Yes.
if there's a need for that. And I speak about this quite often in terms of accessing
Right.
those resources. And I'm sure Dr. Banks Devonish is going to be very grateful for the addition of support, because when she was here, she spoke about the need for additional persons within her field, because having just her
Yeah.
an island, and so to have remote services, I'll tell anybody, I access services remotely.
Yeah.
But it's also it's also a very costly process. And so, and I'm thankful that I had the resources to be able to lead me to that. I get calls once a week, every 2 weeks, where persons are saying, "Where can I go and see a therapist? Who can I contact?"
There is a need.
And there is a need, and it's not just, again, it's not just for actual presenting issues. It's not at the point of medication treatment, but sometimes it's preventative care.
Right.
Yes.
And preventative care, I cannot stress the importance of being able. Sometimes you just need to talk.
Yes.
Sometimes it's as simple as having a safe and trusted space to be able to talk.
Correct.
So Premier, before we delve any further into the exciting part of the news, I mean, Gleneva.
I like the name that was chosen for the program, Senior Shield,
yes.
because a shield sounds like protection. You know, that it protects you fully, and that's the thing that I like about the program. So whoever came up with that,
Senior Shield is great.
They're protected.
They're protected. Yeah, it's,
nice.
I mean,
there's coverage.
we won't give any accolades to anybody in this room who came up with the name.
That is what it is.
So he just touched where Ema wanted to go. He's talking about the shield and protecting. A side that we haven't heard from directly is the side on the health providers.
Yes.
Because I know a number of them feel a way when they hear the stories too. We're not just the ones hearing the stories.
That's right. That's correct.
And I can feel a resurgence of hope when I talk to one or two of them, and they're like, this is where we need to go. Like, what feedback are you getting from those in the medical field under the remit of the Ministry of Health? What feedback you getting?
This feedback is not just from those under the Ministry of Health or the Health Authority. Even the private physicians are happy about this, because basically what they have seen is persons will wait until their disease process is so bad that then they show up. And now they have that opportunity to come earlier, so that there's the prevention, there's a chance of catching disease processes earlier than they were, so that you can treat them faster, you can, get them cured faster. And so that's what I'm getting from the medical professionals. The nurses, the doctors, they're like, now a person comes into the emergency room, there was accident in emergency, and they don't have to, that person 17-year-old, they don't have to think about, this could be my mother, and I'm going to be giving them this piece of paper with the bill on it that they have to pay, the $200-300. They're thinking, okay, that's covered. They don't have to, be thinking, maybe this is a better medicine to give, but I need to give this one that is cheaper. So it takes away that burden on the medical profession, and even the private doctors are saying this is good, because even though they're not coming to us, they're not covered privately, they're getting taken care of.
And that is what's important. That's what's important, and that's the heart. And I mean, you just, when you were speaking, I started to just like visualize. I think by now you know how I think, and like I don't think it's far-fetched that we can see. I don't know if you got a national statistic about the number of persons that have high blood pressure. But think about the worry.
There was a study done in 2016 called the STEPS, STEPS, which came up with that information. I think that's a little outdated now, because that was 2016. We had Hurricane Irma after that. We've had COVID since then. And so I actually just suggested to PAHO that we should do another study. And so far, they are moving in that direction, that it is necessary. But we do have numbers that we can extrapolate. Yes.
Okay, excellent. Because what I'm thinking is, stress is, high blood pressure is not just caused by dietary factors. No. Think about the relief of the stress on everybody, like that has to consider whether I'm going to eat, I'm going to go and see the doctor.
Yes.
The mother that's gonna sit home, the grandmother that sits home, say, don't worry about me, I'm gonna be okay. and knows she's there in pain because she don't want to burden her children with taking her to the doctor because there's a cost involved in taking her to the doctor. The magnitude, the impact of this is so far reaching.
Yes.
It's so far reaching. Like, I'm excited. You don't understand. Like, I'm really, really excited about this. Not because my mother is of age, but because I understand the impact for generations to come.
That's right.
You can have grandparents who are going to age better. Quality of life is going to improve by something as simple as taking care of our elderly because it impacts everybody down the chain.
That's
Yeah,
right.
and you know, we have a number of long livers.
Yes.
Well,
Today is and
Somebody turned
105.
105.
I'm gonna get in trouble because I only know her as Nat.
Everybody knows as that.
So, you know, happy belated birthday, Nat. You know,
Yes,
she turned
right.
105 today, and so
Yes,
while
yes.
we're recording this, and so we do have a number of persons who live well into their golden years.
Yes.
And so for families to not have to worry, well, you know, them past their 10. But we know that they could live 10 plus more.
Yeah, yeah.
That's right.
And we don't
That's
don't
right.
have to really be concerned about what their health care would look like because it's taken care of. And I think that releases, I think like you're saying, Ivan, it releases the burden not just on those persons who are 70 and older, but it releases a major burden on those persons who are the caretakers,
Right.
Correct.
who are
Correct.
the financial supporters of them, which is more than likely a working person.
Right.
And
Yes.
so it is, again, this is a welcomed policy. It is something that I know so many people will benefit from. I was asked this question, and so I'm going to have to bring it. How do we ensure, and I think, Premier, we spoke about this, I think the last time you were here. How do we ensure that the good policies and the good programs continue throughout administrations? Because the fear that I heard from someone was, I hope, you know, in the next 2 years, if the government has to change, that we don't lose this. And that is a fear that a lot of people have because we know that sometimes you lose some of those good policies simply because it wasn't my idea.
Yeah, I mean that's a great question, and you know, it has been suggested that we should ring fence the certain amount of funding that is necessary, and I mean this is captured in the medium-term economic and fiscal plan.
Right.
$6 million this year, you know, $8 million next year,
Right.
and going on because MTEF covers 3 years at a time. That doesn't mean that some other administration can't come in and say, okay, we don't think that this is a good use of the funding and they use it for something else. There's really no way that you can foolproof that, but it's certainly something that we are considering of how we can make sure that this goes on into perpetuity.
Right.
And I think it's important to do that. And the other thing that we want to do is after we've gotten data on this part of the program, we want to see if we can push the age down a little bit closer to 65. That is something that we are thinking for the future. So but first we want to see, because we know that we have the funding to do the 70 and older right now, looking at the actuarial study that
Right.
was done. And we have an idea of how many persons belong to Anguilla that because of the food voucher program. We know that we had close to 800 persons
Yes.
that accessed that program and that was 70 and older. And so we have a fair idea. The actuarial studies were done based on health authority statistics, and so we want to make sure that this is a sustainable program.
You know, I just thought of something. A lot of persons that I speak to, older persons, they brag about healthcare in the UK. Their mother is living there, their aunt, their grandmother, their grandfather is there. And it's all taken care of.
Yes.
Guess what? At home.
They
It's
don't-
all taken
it's all
care of.
taken care of now.
It's
Yeah.
all
Yes.
taken care of, but I'm not going to let it slip because I often hear people bragging about this, but taxes fund those things there.
Yes.
Taxes funded here now.
Yes.
Taxes has funded. We didn't go hand in hand like the Premier said. We thank the UK. government. We thank everybody associated that has continued to support Anguilla, but it's high time. And I think what swells me up most is I'm saying this with a measure of pride right now, because I saw the term promise made, promise delivered, and somebody's status referring to this. And I was like, I think we outside, right? And you can't help but see that's what it is, because this has been something that you tried from getting in day one.
Definitely.
And to have them look you, push you back across the table and say, oh, that had to hurt.
It did.
That had
Not
to
only
hurt.
me, but every member, minister that was there that day, a member of cabinet that saw when it got pushed back and said, you can't advance this because it's unfunded. I mean, it disappointed us significantly. I mean, we've had several disappointments. People may think, oh, you know what we've gotten done so far, it just came and it was delivered to us on a platter. No, you have to fight for everything that you do, because the goal is to look out, to care for the people of Anguilla, and their well-being is paramount. And so, as Geneva said when she basically recited the vision of the Anguilla Progressive Movement so eloquently, you know.
The vision that is in
that was just so you know, that was just completely
empower people so that they, you know, control their own destiny, take care of the vulnerable, the young, very young, and the elderly.
Yes.
That is something that is near and dear to us, and it's something that we try to live up to every day.
I'm excited, man. And you said something, Geneva. You were asking about how do we ensure that like these things continue. And in all honesty, and even though this may sound political, it is what it is. Like you really shouldn't go there and try to stop the progress. Like, in all honesty, the progress that Anguilla has made over the last couple months. Let's just take end of 2022 into 2023 now, where we're at in 2023. My mind goes back to the budget presentation, and I must go I must go to this. I have to read this right now, simply because this was said during the budget presentation. It encapsulated everything that we are seeing now. I'm scrolling, and I'm scrolling some more, but I'll get to it. Here's how I'm going to get to it. I will find it because somebody went ahead and put it up again today. But I have to read an excerpt from the budget presentation that went out, and I'm quoting the Honorable Premier even though he's in the room. The Ministry of Finance and Health has a total of EC 112.69 million for its recurrent expenditure budget for 2023. That's 112.69 million. How much is the budget, Premier? The total budget for the year? You can remember off the top of your head?
Well, now it's gone up, but it was 245 million.
245
Now it's 279 because we had to add in, the money to finish the school.
Okay.
Yes.
So it was 245 then. 112 was put into the Ministry of Finance and Health. Just under 50%, right?
Yes.
There has been an increase of 11.4%, EC 11.54 million over the 2022 approved budget of EC 101.15 million. This is mainly due to the implementation of medical assistance for seniors citizens 70 years and older. The Honorable Premier LSL Webster 2023 Budget Address. Anguilla Reimagined. Economically resilient, socially inclusive, fiscally responsible. Now, I went and I read that verbatim for two things. This ain't just happened.
Right?
This, like you spoke about the actuary study that was done, you spoke about the data behind the situation, you spoke about it in the budget address, and then it's closed on the title of the budget, which is Anguilla Reimagined.
Yes.
Healthcare Reimagined, Premier, because I know this isn't the end for you. Like, if you were to tell us two things. Give us a little insight. You know we like exclusives here. He thought he was going to come back here. So we like exclusives here. So can you give us any insight to what reimagined healthcare would look like for Anguilla? Outside of what we got already. We got our MRI machine,
Yes.
new dialysis unit, isolation ward. We know that we have senior healthcare, Senior Shield, which is free healthcare for everyone 70 years and over that are belongers of Anguilla. We know we have budgeted for a psychiatrist.
Yes.
And a second.
And a second surgeon,
Right.
and we know we have all these support systems and services coming through PAHO and everything else that you're talking about. So I don't want those again. I hope I
Right.
captured everything.
Yes.
But just give us two little glimpses. We
Right.
know the health authority is coming back under the ministry in a couple of months. But what would this reimagined healthcare for Anguillians look like?
Here's what reimagined and taking into focus that Anguilla is a small population, so it's difficult to have specialists come here and say that they can make a living if they were just using market forces.
Sure.
Because most of the time, especially for me as an ear, nose, and throat surgeon, they told you coming out that you have to go into an area with at least 25,000 population to make a living.
Right.
So, but one of the things we want to do is, given that our medical treatment overseas budget is so high, and we have to send people away, and some of them don't come back alive, and some of them don't come back better, and some do get better wherever they go, and they come back, and we thank God for that. We want to see if we can develop services here so that we don't have to continue sending people out.
Okay.
And so one of the things we're looking at is specialty care.
Okay, lovely.
And the ones that I think that have to top that is a cardiologist, because our people are getting older, and so they're going to have, the ticker is going to start to
Requires
fail
more,
on them sometimes. We need to be able to take care of that. And orthopedics. We have the elderly who need their knees replaced or their hip replaced, or they have back pain and need that taken care of. And we have the young who get on their motorcycles. I don't want to single out motorcycle riders because, I admire what they
athletes
do. But I know athletes,
Yeah.
We get a lot of orthopedic trauma that has to go away. And I think that if we can treat that here in Anguilla, because the sooner you can get a person treated, the less chance that they're going to have permanent or prolonged damage.
Right.
And so those are the things that we want to do.
Okay.
And so we're looking at now, how can we afford to bring in those specialists and to have them resident in Anguilla and then provide the services that they would need. And that's going to require some help from our investors, developers, and well-wishers for Anguilla.
Right,
I already, there was a company that was here in Anguilla having their retreat for the employees. And in speaking with them, they talked about making donations, to the hospital, for, echocardiograms, so cardiologists can look at the heart and look at the function of the heart. Mr. Schultz from Aurora has talked with the company that would help us to get equipment for the hospital, for the services that we need if we can get those specialists in. And so there are a lot of things that we are looking at being able to do that we should do.
Right.
One of the things that we talked about early on when I got involved in politics is medical tourism, that we should be able to set up a facility that can provide certain services that persons would come in, bring in foreign direct capital, and then we can have villas that can be used as recuperation villas, where the persons can then recover. And so what it not only does the health and the medical part, but it also uses some of these facilities that we have, some of them that may not have been completed because of the global financial crisis or Hurricane Irma or COVID, where the funding was not available, that we can develop that, because Anguilla then will look better, more modern. You won't have these partially constructed structures. We can get those done. and then we find a use for them. And so that's what I'm out there doing. You know, so I'm not just eating the steaks and drinking the wine like they say that we do. You know,
I wasn't ready.
I know you ain't there yet, but I'm just saying that people, they get up on the radio and they make they say things, but they don't understand what is required to get Anguilla to the place where it needs to be. You have to network. And you have to create relationships.
Definitely.
And the relationships that we're creating, because people trust us. They believe that this administration has the well-being of the people at heart and not their own selves. And I think that what that has done is it has made the investors feel like they're investing in the people, not just in the politician.
Go right ahead. I can feel it.
That's extremely powerful, Premier, because where I sit as PRO, we interact, and I interact with all the ministers, and there's an excitement and a buzz about Anguilla that we're seeing manifest.
Definitely.
And I'm happy that you say that, because I think people think it's just because it's happening. No. People do business where they feel confident.
Definitely.
People do business with places or persons that they can trust.
No, you better believe it.
And and some of the conversations I've been privy to, and some of the things I know about politics in general, not just Anguilla, because I spent some time working in St. Thomas for an elected official after school. So I understand it gets to be a little bit of a greasy game, you understand? And when you have to hear that's a concern, like you meet with people and you have to hear, well, at least I didn't get shaken down.
Yes.
Like it says a lot, because I think there's a confidence, again, for the lack of a better word, that persons have now. We can chop it up to the political climate, we can chop it up to the economic climate, we can do whatever, but there's a confidence that I see bringing some more and more business. So I'm happy that you would have spoken to these persons, because I often wondered, you have all these major groups coming here for their group events. I worked in the industry, I'm seeing them, and these people want to do something, and I've heard in the past that they would have wanted to do something, and then you never hear nothing again. Like, you would never hear nothing again. So I'm excited, and I'm hopeful that I'm gonna see something manifested, because I've seen things manifested thus far. You've had the Richard Schultz Family Foundation come in outside of the MOU considerations which your administration has put in place. Like everybody has to do a social project. They continue to do.
Yeah, and then you had Gary and Connie Sharp, who contribute to getting the shipping of the MRI. Robert Seamus, who is a villa owner at Four Seasons. He contributed. He's contributed to a basketball court down in Blind Point. He's contributed to the getting the MRI here, the storage of it, and he wants to contribute more.
Yes, he did say that.
Yes, he said that, and so that's the thing, that persons want to help. They want to contribute to the community that they have now chosen to be their home.
Right.
And it just has to be that they feel that whatever they contribute is actually contributing to the community and to the development of the people of Anguilla.
Yes.
Yeah.
I'm excited.
I am as well, and there's so much that's happening, and I'm cognizant of time, and know that we're winding down in our first hour, and that we will be back again. But before, in these last closing moments of this first episode, there's something that's still in the back of my mind. Two things, actually, and just to get my thoughts out there. One, listening to those figures that Ivan quoted, $112 million dollars towards healthcare of a budget of it was health and finance. Okay,
okay.
The administrators.
Okay, because I'm glad that you set that up, because that is almost half of almost half of the entire
The entire
budget.
budget, that's
that
correct.
means that every other ministry is competing for half. And then the Premier went on and you spoke about the cost of overseas care.
Yes.
And we bust
That's right.
that budget all the time.
Yeah,
Yeah,
but that
we-
one was busted by the end of February this year. And
Yeah.
it's usually by the first quarter that money is gone, no matter
Yes.
what we budget.
Right.
And that doesn't stop us from sending people abroad. I mean, we still have to find more money. So now we have to get that money. Something else has to be sacrificed so that we can get the funding. Because we're not just going to let somebody lie
Right.
at the hospital and die or send them home
Right.
to die like that. And then that's an issue we have to deal with.
Yes.
Yeah. I know initially, and this is kind of tying healthcare and finance. Initially, when the interim stabilization levy was presented, the thought process was that it would eventually turn over into a national health insurance.
Correct.
We did a number of years of renewing interim stabilization levy. We were told it was going to go. It didn't go. It's no longer interim. I'm thankful that the name has changed, and
Right.
hopefully that is showing. The name change is reflecting more of what it's going to, universal social levy.
Correct. Correct.
Are there any plans or consideration for there to be either for the universal social level to become a NHI or for an addition of a NHI?
Both. One is first to get the NHI, National Health Insurance. The USL would contribute to that fund. And so we have met with a consultant who's been here. We have met with the private insurers to have that discussion of the mechanism. And certainly that is, we are looking into that for national health insurance, where everyone is covered. Certainly, the persons who now pay private insurance premiums and that paid into this, it would be managed through the government, and so yes, that is being worked on. I don't have the details of it, but as I said, we do have a consultant. We've been discussing with it, and we have met with the stakeholders, the health providers, the insurance providers, and the people, and we're trying to work out a mechanism that works best for Anguilla in itself. We've also looked at other, maybe doing a joint venture with other countries in the region, St. Lucia, Grenada, St. Kitts, Nevis.
Great.
How close of a reality is something like that?
We were hoping that it would be in this year, the 2023. I
If
think
if that had happened this year, I don't think the place would have fallen apart. Like,
so all of that takes
Time.
time, but it also takes making sure that you manage the budget properly.
Right.
Because it will take. Right now, we subvent to the health authority. This year is going to be $21 million out of their budget of $39 million. Certainly this, $6+ million that we're putting into those 70 years and older, that will help them. Because think about the arrears that that health authority has.
Yes.
A lot of that are patients who haven't been able to pay for the services
won't be able to pay.
and won't be able to pay, and those a lot of those are 70 and older. So now that's a burden off the budget of the health authority, and so that is something that we have now factored in, and it's going to help.
you see what you did there? Let me check the time in yeah, we got 3 minutes. Hopefully, let me ask this question, because I remember a certain individual querying the move to bring health authority back under the ministry and say it's going to create all sorts of problems. But you just said, Honorable Premier, that subvention of $21 million already.
Yes.
21 of 39.
Of 39.
Right.
But I think you should have a say.
But
Hold on, I ain't done there. Outside of that, we know there are inherited, coherent, and all the other rent issues that we could possibly have with respects to the health authority and the function of health authority.
correct.
we know the challenges that we had. We are just here sitting and talking about all these other things to come on stream. For me, it makes sense to bring them back under. Yes, if you're putting all this in and you want to ensure that your people get the best care.
Yes.
Because you need that oversight.
Definitely.
How is it that we operated with that limited oversight for so long is what I'm asking. Because as the Minister of Health,
yes,
you used to get, like, and this is just me thinking out loud, you used to get adequate reports and know exactly where things was going. You knew what the vision was and if it was rightly being pursued and these type of things, because the buck stops with you, right?
No.
No, the buck doesn't stop with you.
The buck stops with me, but I didn't get those type of reports. Remember that we're only now getting quarterly reports from the statutory bodies because this administration came in and there was an MOU signed by the former administration that said to get financial aid for COVID relief, that one of the conditions was that there would be quarterly reports from the statutory bodies. We're still not getting them. Let me tell you that. We tried. We give the directives. We don't. The other thing is that the health authority was mandated from 2004 that they would give annual reports. Right?
2004.
They did it once before the one that they did 2 years ago. Okay, once from 2004 to 2021, they had done it once in that time. Okay, and that is that is the legislation. So just think about it. You know, the legislation says that the Minister of Health, once the board is selected, that the Minister of Health has to have an arm's length relationship with the Health Authority of Anguilla. And the Ministry of Health signs a contract for the provision of healthcare services with the Health Authority, and then you basically have to just pour money in. And the money used to be anywhere from 16 million to 20 million. In 2020, it was 24 million because of COVID, and then it went down to 20 million. Now it's 21 this year. It's just a matter that, as you said, if I am responsible for the provision of healthcare in the country, I'm elected by the people to do that, you know, and I can't have a say and oversight, you know, in the management of it. I mean, I'm only saying that we can bring in cardiology and orthopedic and stuff into the health authority into the healthcare system of Anguilla because Health Authority is coming back under the ministry, and so it now will be managed in the Ministry of Health. Otherwise, I can make a suggestion and say, Health Authority, please, would you consider it? Pretty please, on my knees, beg. You know, these are the types of things that, unless I can impress on them that they should, you know, get that. And then they're going to look at their priorities, and they're going to say, well, the funding is such and such. We advocated them in this way. And the Minister of Health, who has, you know, the broad, holistic view of what should happen. Now, the other thing you said, well, between 2004 and 2023, why hasn't some of these things happened? Well, maybe it's because, you know, at the end of my name, there are two letters.
MD.
Thank you very much.
No, we don't have enough time to go, because as you were speaking, I think my head went both backwards and forwards at the same time.
Yes.
In terms of, yes, there are those letters behind your name, and there are those letters that come before your name.
Right.
I'm gonna have to rest that one down.
No, we're gonna pick that one up in the next episode. We're gonna continue, but for right now, we're gonna say thank you for listening for part one of this very spirited interview with Honorable Premier Dr. Ellis Lorenzo Webster. This has been another excellent episode of Progress Report. I can't even speak. I'm excited because I know we're jumping straight back in this. We're gonna pick right up where we left off, so make sure you tune in for the next one. Thanks for listening.